Hello and welcome to Recovery for Life. I'm Chris Howard, peer counselor at Midtown Health and Wellness in New York City, and host of this weekly podcast where we discuss addiction and recovery and anything else that comes to mind. Peer, of course, meaning equal, meaning we're all on a level playing field, which means I'm in recovery myself. As of this past January, I've got 10 years clean and sober. I should note that it took me 18 years to get here. Relapse isn't required, but certainly isn't uncommon. Before we get going, it's important to mention that I am not a doctor, and we are not here to dispense medical advice. We also don't advocate any particular course of treatment. Please speak with your physician regarding issues related to your specific medication or treatment plan. If you don't have a program and would like to discuss options, you can find Midtown Health and Wellness at nyc-doctor.com. The series of podcasts is essentially our group discussions on tape. The four others joining me are all part of the Suboxone program at Midtown Health, so one of our recurring topics will be everyone's personal feelings about medication-assisted recovery. The focus will not be so much on our past, our addictions, but how we're navigating our individual paths toward physical and emotional health. Putting down the substance is just the beginning. What happens next is recovery. Going to virtually pass the mic now and give everyone a few minutes to check in, and then we'll dive in. So let's start with Bennie.
Hello, everybody. Welcome back if you've been listening. I'm Bennie. I guess just to give a little introduction, I've been on Suboxone for about a year and a half. I am currently slowly weaning off of it, and it seems like I'm probably going to be off of it in the next couple of months, if withdrawal and stuff doesn't get too hairy, which it's known to with Suboxone. So, yeah, recently I have been definitely struggling a lot with kind of living in, I think today we're going to talk about this idea of living in the wreckage of our future. And like, I've definitely been struggling with kind of trying to control a lot of things that aren't necessarily within my control, and like predict things about my life and my trajectory that I'm not actually privy to, like how things might turn out. And so recently, I guess I've been focused way more on living in the present and learning to like affirm myself and be grateful for the attributes and just like characteristics that I really do appreciate about myself, and like maybe seeing if I can somehow base my future off of that, like seeing myself in a positive life and in a positive light, and trying to figure out how my skills are actually, can serve others. That's also kind of in the change of perception realm. Like I feel like I kind of have had a change in perception recently. So that's where I'm at.
Hey, Frankie, you're up. Sorry about that.
That's all right. Frankie here checking in. I've been with Midtown Health and Wellness for well over 4 years now. Feeling good, just a little work exhausted. Talking about this a couple weeks ago. I had an employee who is struggling with some substance abuse issues, and that employee is no longer with us. And it's weighing heavily on me, because I see another person who I know who works for me, who's starting to unravel as well. The stress of restaurant life is really intense, and, how you deal with it is up to you. And, I'm seeing one of my closer friends have a hard time. And he's definitely not ready to admit that there are some issues. I think he's very lonely, and he needs to talk to somebody, and just an emotional cat. I mean, just such a sweet, emotional dude. But he's going down a deep, dark hole, and I'm trying to pull him out with positivity, but there's only so much I can do. I'm also, keeping him busy here, but it's just tough to see. It's tough to see. And these work days, it's going into now, my third 15-hour day. And, 5 years ago, I would have been, using drugs to get me through this day. And now I just want to sleep. I'm not even, it's not even a thought on my mind. It's not even, there's no urge, it's not a thought on my mind, which is a wonderful thing. But I'm just exhausted. Yeah, that's my quick check-in.
Thanks. Hey, Audrey, you want to go next?
Yeah, sure. So hi, I'm Audrey. I have been with the program for over 2 years. Don't know exactly when I joined, but it was sometime when I was going to school in the city. I've been on pretty much the same dose of Suboxone for those 2 years now. I'm at the point where I'm not really thinking about going off of Suboxone, but rather thinking about how I can improve myself and improve my life while on Suboxone. And sometimes most of the time I overthink things. So this idea that I want to go off of Suboxone comes into my head, and I stress out about it a bit because I'm almost not ready. But I'm not sure if there will be a point when I am ever ready to come off of it. So I guess leaning towards the topic of living in the wreckage of my own future, I am thinking about, even though I'm thinking about how I want to go off of Suboxone in the future, and I'm thinking about, okay, how will this happen? When will it happen? Will I be okay? All of these different possibilities come into mind when I think about that happening, and I don't necessarily have to think about that right now. So, I mean, I do have to have goals and want to accomplish things, and I need to have long-term goals, but I also have a tendency to be really hard on myself when I don't achieve something, or don't achieve something in the way that I think something should be achieved. And if something in front of me, if something is tangible that, like, if I can show progress in a tangible way, like, for example, creating an art piece or cleaning, even something as simple as that, then I'm proud of myself. But I think I really struggle with trying to be okay with where I'm at, and that shows itself in many different ways. I think most recently I have been struggling a bit with feeling really lonely at night, and like, especially at night, because I haven't really been around many people, or haven't really done any social events, and there's just not a lot to do where I live. But in another aspect, I feel like I haven't achieved all I wanted to have achieved in a day, and I end up getting really, really sad about that, especially at night. So that's what I'm dealing with right now.
No, thank you. John, your turn.
Hi, I'm John. I've been with Midtown Health and Wellness for over 3 years. I'm on the Suboxone program, which is a once a month injectable form of Suboxone. I've been on that for a year and 8 months now, and that is my sober time. And it's given me it's been life-saving, honestly. And then for me, it's given me the opportunity to work on myself and any underlying problems that I have with the counselors and good people at Midtown Health and Wellness. And it's been really, really a really good tool for me to work on my sobriety and myself. Really, I just want to be a better version of myself each day, and I'm very grateful to be alive each day and kind of just checking in. As of lately, I have been feeling a bit overwhelmed with a lot of things going on. And they're, for the most part, they're the really good things, like getting married, settling into a new job, and I'm trying to study for this exam that is associated with my job, and kind of falling in line with the topic of living in our own wreckage of our future. I've definitely put myself in this place where I feel like maybe, I don't know, I put these really unrealistic thoughts in my head where I'm like, have I studied enough? Am I going to fail that exam? Am I producing enough at work where, my team and manager is satisfied? All these things that are kind of somewhat in my control, but somewhat out of my control. It could be quite overwhelming. But outside of that, I'm super excited to get married, and that's going to be happening June 11th. So definitely looking forward to that. But otherwise doing well mentally and physically. So
Thanks. Well, we've all got a lot going on. We're coming down the pike, it sounds like. There's a lot of stuff going on, coming up. I thought about this because my perception has changed over time, and that part of this was, the change of perception. And it did occur to me a while back. I was sitting in my car at this beach a little bit south of where I usually live. I'm in New York right now, but in LA. And I was watching the sunset, and a lot of people out there kind of come like lemmings to the beach to watch the sunset every night. It's really kind of fun. Everybody walks down the hill and hangs out and watches the sunset. And I was sitting there and I realized that the sun's not setting, we're spinning. And I started to look at it very, very differently because, we're spinning pretty quick. It's like whatever it was, 1,600, 1,700 kilometers per hour. And the sun isn't going anywhere, right? So the sun is not setting, we're just rotating in front of it. And I'd never thought of it that way before. I really hadn't. So that was a new change in my perception. But the real change came probably 7 or 8 years into sobriety when I stopped waiting for the other shoe to drop and started to realize that there were probably some good things coming my way and not bad things. And not everything was bleak that was coming my way. In fact, nothing had to be bleak. It really depended upon how I saw it and how I handled it and how I perceived it. It doesn't have to be bad at all. So that was a change that came with, like I said, it took a long time for me to get to it. Some people latch onto that very, very quickly. They get sober, they get into a program, and life changes right away. And everything's great and everything's rosy. That was not my experience at all. And that's why it took me so long to get to that. But I did get there. And it wasn't even something I was looking for. I didn't know it was coming. I wasn't waiting for it. Just one day, my perception of the world changed after some time in recovery. And that's kind of where this comes from. So I'll just pass it along. There's no raised hand feature in this thing, so it's just kind of a wave.
Yeah, that was not my experience either. It took me, it took a couple of years. it took me as much time to fix it as it did to fuck it up. So, I mean, I was a disaster for a decade. And, as I started to decide that this doesn't work anymore, and, I need to make some changes in my life, and I need to get sober, and I need to see that through. I mean, it was good. It was a good three years into sobriety when things finally started to change for me, and I started to see things differently, and I started to, not second guess myself, and really just accept the fact that, really accept who I was. And then things started to change around me, and I started to notice it, with career and with life and with love, and all those things started to finally come around after years. So, it didn't happen right away for me either.
You said the magic word, acceptance, right? Accepting who we are, what we were, what we're going to be is a big deal. Because, I thought I was, the worst human being in the world when I got into recovery. And everything was always going to be that way. My first 2 years sober were the worst 2 years of my life. It was terrible because, of course, I was on a trajectory. And everything that was going on externally wasn't going to stop just because I got into recovery. The mortgage company didn't care. Child support didn't care. The people who were suing me didn't care. The state of New York didn't care. That was about me. And, I had to get through all of that. And it looked really bleak for a long time. I mean, it took me 6 years to get to a place of what I call absolute zero, which is, zero on the Kelvin scale, not Fahrenheit or centigrade. It's all the way down. But it was zero, and zero was an amazing place because I had to climb to zero.
For a reset, right?
Yeah,
exactly. For a reset. I just thought there would never be a time when everyone trusted me again. I thought that I had done so much damage to myself in so many relationships that there would never be a time when I went to the bathroom that everyone didn't go, what's he doing in there? You know what I mean? I'm taking a pee-shadool. That's what I'm doing. I can't go into the bathroom to pee anymore without people thinking, oh, he's in the bathroom doing this. That took years for people to not notice anymore that I left the room, because there was years went on when every time I left the room, everybody spun their head, and it took years. And now, I feel like, that's different, and, that's changed. And not only has my perception changed, but people's perception of me have changed as well with time.
Well, good point. It does. Other people's perception of us changes along with it. That's a really good point. And trust and all of those things that we earn back. We have to earn that. It doesn't come easily. That's a really good point. I like that you turn that around to how others perceive us, because that's really important too, and that's really comes with the territory. Who else wants to jump on this subject? John, go for it.
Yeah, I actually kind of, after your shares, Frankie and Chris, I kind of feel grateful to be in the position I am today. I did have to do a hard reset on my life, like literally give up everything materialistic and kind of start over. But I have such a great support system, and without it, I don't think I'd be as successful as I am today. It's really what has helped me, make the progress I've made in my sobriety. I definitely relate, Frankie. I didn't ever think my parents would trust me again either. Same situation. I'd go to the bathroom, they're like, whoa, what are you doing in there? Picciadule. Yeah, I'm a fellow Italian, so I definitely know what you mean. I was laughing at that. But anyway, I just wanted to say, it takes a lot for me. It takes it takes a lot out of me to really focus on myself, and really put myself first, and trying to remember that on a daily basis. Because if I do not do that, and remember that my sobriety comes first and stay vigilant, I'm just going to end up dead, or I don't know. I mean, I really, that's how I really look at it now, is like it's a life or death situation. So I don't want to ever put myself back in that situation. And I do feel very, very grateful that, my first year and 8 months in sobriety, I've been battling addiction for over 15 years. I had a period of time, like 6 months maybe, of sobriety. But even then, like, I didn't have a support system. Like that was the missing piece to the puzzle for me, was like having a solid support system. And that's what's been really, really helpful for me to kind of move forward in my sobriety and work on myself. But I do find myself, still like second guessing myself, like constantly. I had this conversation yesterday with Chris. I was like, I'm gonna fail this exam. Like, I'm like, why am I thinking that? Is this? I guess it's, I am only human. You would think that with all the crap I've been through, I would know that, putting that type of thought in my head would only lead to me failing the exam. But, it's just one of those things that just, like, I don't know. It escapes me sometimes, and I have to have somebody in my support system remind me, like, listen, you cannot put that type of mindset. You can't have that type of mindset, or you're gonna fail. And it was a nice wake up call, and that's kind of just what I wanted to just bring my 2 cents to the table with.
Nice, thank you for that. Yeah, Audrey, go for it.
All right. So I was thinking about both what Frankie and John said. What Frankie said about the having people around you that almost bring you back to the place where you were by making comments or making assumptions that you're doing the same things that you were doing in your addiction. Like every time you go to the bathroom, you're using. I feel like I can relate to that in the sense that I spent most of my addiction living in my parents' house. So for me, a lot of those feelings come up around just feeling like they don't trust me, or like they see me getting sad, or like going up into my room, or I don't know, going out. And I always think, I think sometimes that they are scared for me and scared for what could happen to me based on the things that I have done, like going wherever with my ex-boyfriend to use all night, and self-harming myself when I'm alone. But I think that, well, I know that my parents have a lot of trust in me now, and I know that they have nothing but love and support for me, and I'm very grateful for that. I'm very lucky, and I think that goes back to having a support system, like John was saying. I am I'm really grateful again to have such a solid support system in my life that will care about me no matter what. And I'll always have a place to go back to if I mess up, or I always have someone to lean on. My sisters, my family, and my friends especially. I was not very good to my friends when I was in active addiction, and I would not respond to their texts or calls. They were extremely worried about me. I missed my friend's birthday, and that was something that, like, I didn't call her, I didn't text her, and we're very good friends. And recently we talked about this because we're still friends now, thankfully. And I told her, I'm so sorry for being absent for this giant part of your life. And I'm so happy that now we can be okay, and I can be honest with you. And she also dealt with some addiction issues, so I think she understands. But yeah, I think I'm just really lucky to have a support system. And I do still struggle with reaching out for help and accepting help. I think it's really easy for me for my mind to take over my my everything, I guess. It's easy for my mind to take over my mood, my feelings, and in a negative way. Like, I deal with a lot of negative emotions and those come and go, but I think reaching out for help and accepting help is very important, especially when you think that you can't. When you think that no one's going to understand you, nothing's going to help. I've been in the deep, dark places where I think no one could ever help me. But I think that, that once you start accepting help and reaching out for help, that's when things get better. And some of it is luck. Some of it is being a caring person and having people care about you. And, yeah, I don't know. Just, I could go on, but I'll stop for now.
Thanks. That was really moving. I heard this other word, success, that John used before, and I wrote this down, how we measure success, and I think that there are, of course, lots of different ways to measure it. Certainly financial and, having the job and everything. But from what we're talking about, I mean, I think a real measure of success is how we perceive ourselves and how we're perceived by others. That to me, that and, the comfortability with myself and the ability to bring my honest self into every situation, that to me is a real measure of success. Because that's definitely not something I had before I got into recovery. My perception of myself was I was in the toilet. I mean, that's who I was. I was a terrible human being. I didn't deserve a single thing. I didn't deserve to have friends. I had no one left when I got into recovery. I mean, there was no family, no friends, nobody talking to me. So you're very fortunate, Audrey, that you had your family stuck around. It's great that you still had some kind of support system when you got into recovery. Some of us do, some of us don't. It's just kind of the luck of the draw, how far down we go. It doesn't really matter that much. But we all need to earn back the trust. We all need to get our families back if we can. I just, as you guys probably know, went to see my kids last week, and I managed to get all three of them in the same place at the same time. And I made a direct amends to the three of them sitting at dinner one night, and that was pretty amazing. None of them left. They stuck around, and and it was just that simple. I explained what had happened. I told them the story. I was honest about my addictions and my recovery, which I had never been with them before. They didn't really know. And I think that I brought my honest self to the conversation. And interestingly enough, I thought I would be very, very nervous when I got to that place, but I wasn't, because I knew that I could just be honest. And then the result was going to be whatever it was. I have no control over that. Just like taking a test or anything that we do. I had an interview a few weeks ago. I practiced what I usually preach, and I brought my honest self, and I didn't worry about what the outcome was going to be. All I could do was bring me to the table and then let the result, let it go. There's nothing I can do. I have no control over that. And I didn't want to cast a negative light or a positive light or any kind of light. It was just, let me just bring me, see what happens. That was a first for me. I can tell you guys, because I haven't been able to do that up until now, to really feel that when I'm bringing my honest self to the equation, I don't worry. I don't get nervous because I have no control over the result. But I know I'm okay. I've spent some time in recovery. I'm okay with me. My perception of me is that I'm okay now. And I'm not going to fail. And if I do, I'll take another crack at it, right? Or I'll do something else. None of it's going to be the end of the world. And that's a huge change in perception. Like, it's ongoing, right? I mean, 10 years in, this is still happening for me. I'm still changing. My perception is still changing. My view of myself is still changing. My self-worth is still changing, growing, hopefully. And that's not something that ends. And the future looks pretty bright, or at least it doesn't look glum. It doesn't look miserable. It doesn't look like it's going to be a train wreck. I don't really know what it looks like, to be honest with you. I have no idea what my future looks like. I don't know what tonight's going to bring. I'm going to go to a meeting after this, and I'm probably going to see some people I haven't seen in a long time, and that'll probably be great. And if it's not, it's not. I mean, what can I say? I think it's a big deal to be able to look in the mirror and not judge myself. I'm not going to say I love you. I'm not going to say I hate you, but I'm not judging me. I'm just being who I am. It's taken me 10 years to get to that place. This is not easy. And like I've always said, I'm a little bit slow on the uptake, so it takes me a little longer than some to get to these things. But we all get there, I think. I don't know anybody who hasn't in recovery at some point gotten to that place. And it's a beautiful thing. It really is. And these are all unexpected. Getting into recovery for me meant, okay, well, I'm not going to drink and I'm not going to use drugs anymore. I had no idea beyond that what this was about. I didn't know. I didn't know that this was the result, or one of the results. This is not the result. It's one of the results. This is a fringe benefit of my recovery, is that I'm pretty comfortable with me and I can be honest with you guys and everybody else. I don't know. It's pretty amazing. Bennie, you're up. Go for it.
Hello. I've been getting up the courage to like tell a little story that's related to what everyone's been talking about. Because I'm feeling a lot more anxiety than I normally feel in these groups, because I think Chris is totally right that when you're in recovery, as hard as it can be, and it can be really hard emotionally, but if you're doing the work, like when you show up for things, you can really be like a whole self. I don't know, there's just kind of like, I guess it can take a long time, but it's something that I've kind of gotten used to in recovery, is like less anxiety, less like this kind of toxic self-awareness, and trying to prove things, and just kind of more ability to be in the flow. This meeting has kind of like encouraged a change in perception for me already, and I'm able to talk like this, but I don't know, for the past like 10 minutes I've been dissociating pretty hard, because recently I've been like, I discovered this writer who's like in recovery, but still uses like substances basically. And for whatever reason, I don't know, I found him really compelling and started experimenting with like psilocybin and cannabis again recently. And I think, I don't know, I guess I was trying to maybe use the language of recovery, or what I've learned in recovery, to like, for whatever reason, I think it was some very complex, like, series of excuses getting back into it. But I definitely feel like a lot more fractured right now. And like, I don't know. I just have to put that out there because that's kind of a more honest check-in for me. So yeah.
Thanks for that. So what is this writer doing? I mean, what's he writing about? He or she?
It's auto-fiction, which is like, it's almost more like nonfiction. It's like he wrote, so he's written a lot about his experience and addiction to pharmaceutical drugs, and just like relationships. And he's Taiwanese, was born in Virginia, grew up in New York City, went to NYU, studied journalism, but writes a lot about drugs and relationships, and has since, I don't know, he recovered from pharmaceutical drug addiction and got into like studying Terence McKenna, and who like wrote a lot about acid and mushrooms and DMT and stuff, and then he wrote a book on all that stuff. And I mean, obviously there's like a whole spiritual wellness philosophy type community that's interested in those kinds of substances. So I think that there's a lot of attraction. I mean, for me at least, it was kind of like a magnet because I was like, okay, I just still get to scratch the itch. I don't know. I'm just such an addict. And that's the thing, is like, I don't know. I think there might be so much, like a lot of potential with these substances for maybe other people, but and I'm gonna have to learn on my own. I don't know if I'm gonna be able to like cut it off right away just because I'm having this moment of honesty. But I don't know. I'm just definitely an addict. It's just something I'm really realizing today, that I haven't changed at all, and it doesn't really matter what the substance is. Like, I can be taking 0.2 grams of psilocybin mushrooms in the morning and still have just like a change, just a mental shift that makes me kind of less honest, and just makes me want to keep it a secret. And it makes me feel a lot more alone, I guess, than I felt before, when I felt like everything was out on the table. Like I was still connected to all the people I've met in recovery, and like there's just kind of like an honesty pact or something. So yeah.
Thanks. That was a great, almost definition of addiction, and just that little bit took away your honesty and started to make you withdraw into yourself and stop communicating, stop being part of the community. That's what addiction does, right? We all wind up there at some point, and it's a slippery slope. Go ahead, Frank. You want to say something?
I do. I was in Alexandria 2 weeks ago for Easter, and I don't know if we've discussed this all together, but my father's been an alcoholic for 40 years. He did not accept this, and here I am, successfully on the other side of this, who can speak intelligently about addiction and all this. We're out to dinner, and he's going into this diatribe about his sobriety and how, he could, it's not that he can't drink, but if he has one, that I just can't stop this fucking robotic, just script that he just has said so many times. And then we leave, we all say goodbye. And I'm sorry. We the three of us, my mom, my wife, and myself, we went to dinner, And he's like, my knees hurt. I'm going to go home. So we can't get into this place. So we end up circling the block. And, 20 minutes go by and he walks into the hotel. And my mom's like, where were you? He's like, I was taking a walk. I was like, all right, just leave it a bit alone. And then we're going to leave the next day. And he's like walking through the bar. Oh, where's the gym? The fuck out of it. I'm a professional drug addict. Okay. Like, it just the lies. Then we leave, we all kiss and say goodbye after this weekend of him preaching sobriety and all this stuff. And they're going to a party at my parents' friend's house, and my dad stops short and a bottle hits him in the feet. And my mom looks down and there's a bottle of scotch. And it just the lies and there's just if the guy could be honest with himself about this, and he can be honest about where he is, and if he could be honest like you were about, if he could be honest about this, I think he could tackle this and beat this thing. But he can't be honest about where he is in this journey. And it's just one lie after another. And I think that, if he was able to accept this, honesty would happen, recovery would happen, future would happen. And then all these things, this trust that, my poor mother, who I beat her up for 10 years with this whole thing. And, he's beating her up with it. And like, she has such problem trusting because of all this. I think that would eventually be reestablished. She knows it could happen because she sees I'm on the other side of it. So she knows this can be done, and he just can't be honest about it. And it's tough to watch. Anyway.
It is. The first person we always have to be honest with is ourselves, right? And if he can't do that, then, that's where we all start. That's when we walk in the door and say, I need help.
Yeah. I can't lead the horse, man. He's not interested in therapy, and he doesn't think he has a problem. His father lived till he was 99 years old, and my dad just thinks that that's going to be the way it is. And it just doesn't work like that. That's not the way it works if you're in a bottle of vodka secretly. It's just not the way it is.
Right.
Sure.
Yeah, you're absolutely right. We all did that. I did it for years and years and years. I had bottles under the seats in my car. I had bottles in the garage. I had bottles in the file cabinets in my office. I mean, it was everywhere. It was everywhere. And I thought I was hiding it, right?
Yeah, me too. It was me in secret. It was, it was tinfoil everywhere. Oh, nobody knows.
Right.
That why do I have rolls of tinfoil? Nobody knows. Nobody knows. I just like to wrap up sandwiches constantly. You know what I mean? It's just, I like to wrap up my own food all the time. Yeah, nobody knows.
Compulsive food wrapper. It's amazing how we delude ourselves into thinking that we're okay and nobody knows what's going on. Right? I mean, we can't trust ourselves, let alone how can we ask anybody else to trust us? It's a hard place to be. I've been in that place too, Frankie, with people I was very close to. I'm sure I told you guys about my fiance who didn't make it out of her addictions. I was around the corner in a church lighting a candle for her just the other day in the church where her funeral was held 7 years ago. And she was the same way. She thought she was hiding it. She thought she could handle it. She thought nobody knew what was going on. And of course, we all knew what was going on. It's just, you can't do that. We can be the examples. That's all we can do. And if they don't pick up on that, they don't pick up on it. There's nothing we can do about that either. But like we all say all the time, we need to take care of us. John said that too. I think Bennie said it too. We need to put ourselves ahead of all this, take care of ourselves. And then, if it works out well, people come along for the ride. But we can't, and you can't tell anybody else to get sober. we can't do that. Causes resentment. They don't want to hear it if they're not ready. As Audrey used that word that comes up a lot, ready. The other day I was reading with my sponsor. We were going through this, it's not an old book, but it's about how the meetings used to go way back in the day, where people went through all the steps in 4 hours and then started to pass it on to other people. It's a really interesting book. But anyway, the point is that she asked me about step one, and we were talking about it, and she said, what happened when you first came in? And I said, well, I wasn't ready. And she said, well, what do you mean you weren't ready? What does that mean, ready? And I said, well, I didn't think I had to. I didn't think I could stop. I didn't think it mattered. There are a lot of things that went into that word ready. It's a very loaded word, and nobody really asked me that before, because I've been using it for years. When people are ready to get into recovery, when I was ready finally to get into recovery, what did that really mean? And what did it mean when I wasn't ready? That was a perception of me too. The perception that I could get away with what I was doing. I could continue with what I was doing. And I could continue to delude myself that I could live my life that way, which obviously wasn't true, because everyone abandoned me. And I don't blame them, because I was not a nice person either. I think you were talking about that, Audrey. I was not nice to people. I thought I was, but I really wasn't. I was thinking about me. I was thinking about my selfish needs, feeding my addictions. That's all that really mattered. I didn't give a shit about anything else. The only thing that mattered was the next bottle or the next drug or whatever it was, so that I could maintain, because I was maintaining. I was not enjoying. I never enjoyed using. I don't think. Maybe when I was 13 and I was dropping acid, that was kind of fun. But since then, it was downhill. Nothing. It was a need. It was a compulsion. It just seemed like it was part of my life, and it wasn't something I could do without. And that went on for 40 years like that. That was a lot of deluding. And that was a lot of dishonesty on my part. So it was pretty miraculous to be able to become an honest human being. I think John just kind of raised his hand. Did you do that? Yeah, go for it. You're up.
Yeah, I didn't want to interrupt you. Sorry. A few things came up for me.
You can interrupt me anytime, believe me.
Yeah, just on the topic of being ready. I mean, for me, I had to go through some tragic events for me to realize, going back to what we were saying earlier, all I knew is that I just wanted to stop using. And I had two particular bad incidents happen to me. I totaled my car so bad that I ended up in the ICU with a concussion. This was December 28th of 2018. And 3 days later, I'm discharged from the hospital. I get my property bag back, and it was just my jeans and sneakers. I get home to my parents' house, and this is the insanity of the disease. You would have think that going through such an experience like that, that would have put me in the ready state, right? No. I had to take it a step further. I had to OD a second time, to the point where, the paramedics were going to pronounce me dead in like 10, 15 seconds. And all of this is happening in front of my parents, and to this day, I don't know how they cope with it, but hopefully one day I could talk to them about it, because I would like to make amends. I'm doing a living amends just by bettering myself in life, but I didn't know I was ready until I freaking died, and they had to bring me back to life. It's like, why? I don't know. I can ask myself why, but there's no point. It's just like, I don't know. If I was to put myself in my parents' shoes, how do I reestablish trust with my son, who just lied to me perpetually over and over again. And here I had to witness him die pretty much 2 days in a row. And you know, what does that do to somebody, you know? Like, and I don't know. I was on the giving end. They were on the receiving. So it's different for me, but it was traumatic. It's so traumatic that, you know, I did a complete reset on my life. I sold my condo. The car was already totaled. I quit my job. I liquidated my 401k so I could pay for my recovery. I just knew that I wanted to live. I wanted to just live and be a better person. And it is such a relief. And maybe this is related to like changing of perceptions, but you know, I'm grateful every day I wake up and I'm alive and sober. It is such a miracle for me, you know, like because I could have been dead. I could have been another statistic, you know, just another number. And what that would have done to my family, my gosh, I can't imagine, you know. Let alone them witnessing that is just traumatic alone. But I just, for them to lose me, I mean, that's just sad on a whole nother level. And yeah, you know, like, what does it take to be ready? I don't know. You know, that's a good question for me. I had to nearly lose my life. And now I get to be an open book. I'm literally an open book. I have nothing to hide anymore. It's so liberating. You know, I can just bring my genuine self to wherever I go and be open and honest, and really having those discussions with my parents now, like talking with them, like openly and honestly. It's just, it's a whole different experience. You know, it's something that I had to get used to and kind of like build up to, you know, because it was, at first I was really ashamed of myself, and you know, I didn't know what they were thinking of me or whatever. But anyway, I'm on the other side of it now, and it's a good feeling, and I'm very grateful to be here, and yeah, ready.
Yeah, honesty is like getting freed from prison. Being able to be honest, it really is. It's so freeing. I got to bring this up because you said one of my favorite phrases in all of recovery is "you would think," and I've heard it. I can't even tell you how many times. I've been in thousands of meetings, and over and over I hear people say, "Well, I drove off a cliff, and you would think that would have, done something, and it would have gotten me sober," and it never does. You know, you would have think me being in handcuffs, doing the Macarena in front of a state trooper would have been enough to get me sober, but it wasn't. It wasn't enough, And I hear this all the time. I mean, I was in that category too of you would think, and it just, you don't. And, as addicts, we go, no, I wouldn't think that would do it. It just wouldn't. It's just crazy. Audrey, you're up.
That's how I'd raise my hand in school. I'd be like, should I do it? Should I not? But living with anxiety. John, I'm very grateful you're here. I'm grateful everyone is here. But yeah, grateful for you all. And just wanted to say that to start, but it got me thinking about how in recovery we kind of have to be ready to start our lives over and face, at least for me, face what I was not ready to face. What I turned to drugs for. I wasn't ready to face my own fears. I wasn't ready to face reality or dealing with myself, my mind, and social situations, and I wasn't ready to face any of that. So I think when I was using, I was just not ready to live, I guess, to like live my life openly and honestly. And I think when I stopped using and I had to start living my life again, or not living my life again, but rather live my life as honestly as I could and try to face my fears and face things without a substance. That's just when it gets really hard. And yeah, I just think that learning to live your life again after using drugs for a while, it's really hard, but for me it's worth it, and it's much better than resorting to using drugs and feeling like I just wanted to either disappear or put my mind into such a different state that I didn't have to think clearly and nothing mattered. But yeah, I think it's just hard to get to that point where you're ready to start living your life, I guess.
Yeah, you're absolutely right. And you themed another podcast that will be coming up, Facing Our Fears. Thank you for that little hint of what's coming down the pike. Bennie.
Yeah, I mean, it's also just crazy how interconnected all of these different themes are, because, like, I don't know, to me, well, it's like most of the virtues of recovery seem to be kind of like just interconnected, like they just happen mutually. Like the idea of like struggling with living in the wreckage of our future, and versus kind of like starting to live life on life's terms, which is like a saying in AA, which I associate with like what Audrey was just talking about, of like not being able to just like hide from this deep emotional emptiness anymore, and actually having to respond to it in a way that is like affirming or productive, or just like feels good, feels good without also being destructive and isolating, and like I don't know. And it's like you just, yeah, I don't know. It's kind of like, I feel like in what has been happening in recovery, is like realizing how meaningful it is to actually build like a caring relationship with myself, where like I know what to do if I'm freaking out, and like I know how to be resilient, and honest, and yeah, I don't know. It just kind of puts the emphasis on what you can control in the present moment, to live your best life. It's kind of a day by day thing. You don't have to live so much in the wreckage of the future when you're doing that kind of thing every day.
Yeah, you're right. We get to live in the day, live in the moment, and not worry so much about what's ahead, because we have no control over that. You're absolutely right. It's a great way to live. And also when those moments come when things feel a little stressful or tough, that's where the community comes in, and that's where those phone numbers and being able to reach out to someone that in recovery that gets it, is at the other end. It's really important. It's been important to me over the years to have somebody like that. And on that note, we are coming to the end of this episode, so I think it's time for the lightning gratitude round. And who wants to go first? How about Bennie? You want to go first? The gratitude round?
Yeah, definitely. Yeah, I'm grateful for all of you. Really, really grateful for this group. And I'm just grateful that I if I come here, I have to be honest about what's going on in my life. I don't think I don't really have, there's a lot of areas in my life where it's actually better not to tell the whole story. Like with my parents and stuff, like I do want to maintain like I have a similar relationship with them that Frankie and John had expressed. So I don't want to just like, I can't just throw this information at them because that, could hurt a lot. But here I can actually say what's going on without worrying about that. So I'm really grateful for that. And I'm grateful for the New York Public Library system. I'm going to start trying to use it more. Yeah.
The 42nd Street's a cool building. Speaking of honesty, being honest doesn't necessarily mean wearing our lives on our sleeve all the time. It just means, bringing our honest self to the conversation. Frankie, you're up.
I am also grateful for this group. This is definitely the highlight of my week this week. Bennie and everyone, very grateful for your honesty today. It was good session today, people. I'm grateful for my wonderful, understanding, brilliant wife. And I know our listeners can't see this, but I am grateful for this lighting. Look at this. Look at that. How silver fox is that? Look at that. I am grateful for lighting. I wish people could see. But they'll just have to imagine that the voice on the other side of this is kind of like a Brad Pitt looking kind of, Brad Pitt meets, I don't know, Michael
George Clooney.
In a, Pacino-y, I don't know. I'm rambling. I'm grateful.
Self-love, everybody.
I'm validating the Brad Pitt kind of George Clooney look there. It's
obviously
for anyone listening who can't see. John, about you?
Yeah, I'm super grateful to be here on this podcast and partake in such a great session today. It was great to hear everybody's shares, and it was a great topic. Chris, thank you for hosting. Grateful for that. Grateful for my fiance, my loving fiance. We're gonna get married literally in a month. I'm so excited for that to happen, and looking forward to the honeymoon. But I'm grateful to be here, to be alive, be sober. That's really it.
Thanks, Audrey.
All right. I am grateful that these headphones actually look good on me, because I always thought I looked dumb in big headphones. And so I'm just as vain as someone else here.
Well, what are you talking about? What are you talking about?
No.
What are you talking about?
Just kidding. But yeah, I'm so grateful for you all. Truly and honestly, very grateful for you all. So grateful that I get to even share my thoughts on here, and that I get to have conversations with all of you. It's great. And I'm grateful that my sister and her boyfriend are visiting, because I always have a fun time when they're here. So, and grateful for my mom.
Thanks. And we have to remember Rule 62 of AA, which states, don't take yourself too seriously. Got to remember that one too. I am so grateful for all you guys. This is a gift to be able to do this. I could never have imagined ever doing this in my lifetime. So speaking of not knowing what the future will bring, here we are. Here we all are talking about recovery and having a good time and having incredibly deep and honest conversations. I couldn't express enough gratitude for that. So on that note, thank you all once again for bringing your insights and incredible honesty to this group. And thanks to our listeners for joining us. If you have any thoughts you'd like to share about anything you heard today, please send us a note through one of the various available channels. We look forward to hearing from you. Thanks again, everyone, and have a great week.